A 28 years old man undergo complaints of the right hemicolectomy for treatment of the 5 centimeter appendiceal carcinoid. As a part of the follow-up, he due to undergo 24 hours urine collection for 5-hydroxyindole acetic acid or 5 here. Which of the following cause an elevated 5-hydroxyindole acetic acid in 24 hours urine collection? That means normally 5-hydroxyindole acetic acid or 5-HIAA, it usually inhibited in the carcinoid syndrome, but in the carcinoid syndrome the patient undergo right hemicolectomy. But what are the normal physiological condition or the chemical substances which can increase the 5-hydroxyindole acetic acid in urine? So we have to find out the substances or the food. Here the options are naproxen, warrants, flucloxacillin, amiodarone and beef. So let's see, it is important to be aware that falsely elevated 5-hydroxyindole acetic acid to avoid the diagnosing of the carcinoid syndrome. That means the 5-hydroxyindole acetic acid typically is diagnostic for the carcinoid syndrome, but the 5-hydroxyindole acetic acid may increase in some other cause. Now let's see the causes. First of all, the food are spinach, cheese, wine, caffeine, tomatoes. So these are the food, and this food may increase the 5-hydroxyindole acetic acid. Again, see, it is the spinach, cheese, wine, caffeine and tomatoes. And some important drug also may increase the 5-hydroxyindole acetic acid. Among them, the naproxen, which is one of the important NSAID, the naproxen, which is the NSAID. Then second one is the monoamine oxidase inhibitor, that means the MAO inhibitor. So these two important type of the drug may increase the 5-hydroxyindole acetic acid. First of all, it is the NSAID, and then this is the MAO inhibitor. And also the recent surgery. So recent surgery is the another excluding factor. So when we want to see the 5-hydroxyindole acetic acid in the urine, first of all we have to take history for the food like the spinach, wine, caffeine or tomatoes, including the drugs that the patient taking any drug or not, such as the naproxen or MAO inhibitor or recent surgery. So here we can see this is the NSAID, which is naproxen, NSAID. So it is one of the NSAID, and it increase the 5-hydroxyindole acetic acid. Warrants not true, flucloxacillin also not true, amiodarone not true, beef also not true. So the only true option which increases the 5-hydroxyindole acetic acid in the urine falsely, it is the naproxen.